So I'm talking about the role of behavioral science in cancer control. I myself am trained as a health psychologist, so this is my area of interest and expertise. And yeah, I'm kind of making the case for the role of behavioral science in cancer control, in that it's actually fundamental and a key component for the success of any cancer control intervention. A lot of the interventions may seem like biomedical interventions, for example, cervical screening or the HPV vaccine or cancer treatment, but all of those things actually rely on human behavior for them to be successful. If women aren't prepared to go for screening for whatever reason, or let their daughter have the vaccine, or people not adhering to treatment, then all of those interventions will fail. So unless we pay careful attention to socio-behavioral factors, interventions won't be successful. So behavioral science is really about trying to understand why and how humans behave, and then looking at how we can intervene to improve things for them, for their well-being. Well, of course, a lot of cancers are caused by lifestyle-related factors. So there's a lot of work, I suppose, that can go on in prevention. So if we think about tobacco and diet and obesity and alcohol consumption, those are all key risk factors for many of the cancers. So trying to change behavior around tobacco use, of course, trying to get people to exercise more and eat a better diet. Those would all be behaviors that we try to change. And then, of course, also on the prevention side, uptake of screening and uptake of vaccination where available. Yeah. Yes, definitely. I mean, I think, there are a lot of contextual, social, economic issues or barriers, I suppose, in Africa, I think more so than in developed world countries. In terms of, for example, take the example of someone trying to access screening. Firstly, the healthcare infrastructure may not be as good, more than likely won't be as good, which means long waiting times. The proximity to the clinic is, a barrier potentially to someone uptaking screening. Also things like, people's beliefs and understanding of cervical cancer. So knowledge and awareness is often quite poor, particularly in rural areas, so that as a starting point needs to be addressed. If people aren't even understanding their risk or why it's the importance of screening or vaccination, then that's your first barrier. But then there are lots of other barriers along the way, and other beliefs and cultural beliefs and misconceptions as well. I think it does feel like there are more challenges, certainly in an African setting, in terms of changing behavior. Yeah, so I think one of the things that I talk about in my presentation is the fact that we have not actually in Africa made use of the many behavioral change theories that are already in existence. And they've been criticized to some extent because they focus so much on the individual without taking the social and contextual issues into account. But there are some that do, and I think all of those things need to be considered when we're looking at changing behavior. So there are constructs that have been shown to influence behavior, like the way people think about their risk perception, what they believe to be the social norms in their environment. What are other people doing that are like me, kind of thing. How at risk am I? What do I think about the intervention that's being offered? Do I think it works or not? So those kind of beliefs and thought processes can be manipulated and changed, through information and other interventions. But then you also probably need to look at some of the other factors, like there are a lot of gender-related issues in Africa. So you may need to look at the role of the spouse in, a woman attending for screening. If she doesn't have spousal support, then that can be a barrier. So you may need to intervene with other key people in her environment, and so you need to address things at multiple levels. Policy changes may be required, other structural interventions as well. Yeah, I mean, I think there are lots of different ways, and that requires research as well. So before you would need to look at a particular, because each community, each country, each place is going to be a little bit different in terms of what their needs are. So you would need to do some formative research at the start to look at what is going to be the best way to communicate with this population. What are the literacy levels? Do we want written information? Do we want radio information? So, I would recommend focus groups and interviews with stakeholders in the beginning to look at what they want, what they think is going to work for them, and so the healthcare providers need to input on that, but also the people who are going to be receiving the message. So it's quite a long process, but if you're going to do it properly and you want it to work, then that's how you do it. So that's where it can, well, certainly from our side, we have an advocacy role as well. So we do lobby for legislation changes and push back, and we are included in a lot of the forums and the meetings with our own National Department of Health and local and provincial Department of Health to make sure that these things stay on the agenda and that changes are pushed through. And actually, tobacco as an example in South Africa, we have really good legislation around that. Yeah, I think one of the big issues in Africa as well is that there's not actually a lot of behavioral science expertise, and we really need to focus on building capacity in that area. So I'm not suggesting that we need to train a whole lot more sort of psychologists, but I think there are people who are working like nurses and others, people lay trained healthcare workers who could also be upskilled around behavior change theory and information, and that would really help.